Welcome back to Takeout. Welcome to the Conversation Corner. The Food and Drug Administration approved removing safety warnings from several menopausal hormone therapy products. Health and Human Services Secretary Robert F. Kennedy said this move, it's a pretty big one, helps women gain information, quote, free, he said, from exaggeration or fear. FDA Commissioner Marty Makary joins me now. What's the exaggeration and fear that was present that you believe you've eliminated now?
Well, good to be with you, Major. So back in 2002, when this dogma really ignited and created this fear machine that's been going on for
That's what you call a dogma.
Well, there was a dogma. Let me tell you exactly what the dogma was. That you had an increased risk of dying of breast cancer if you took hormone replacement therapy for the menopausal symptoms that you were suffering from, or if you continued it for life, that you were increasing your risk over that lifespan. We now
for other
know,
diseases,
and,
yes, was the warning, yes.
The warning was that it could cause breast cancer, stroke, heart disease. We now know that it's more nuanced. If you start hormone replacement therapy within 10 years of the onset of menopause, you have a much lower risk of dying of fatal heart disease. You have a much lower risk of Alzheimer's and cognitive decline. And you have much stronger bones, and older women die from broken bones sometimes. 1 in 3 women who are age 80 or above will have a hip fracture, and a hip fracture has a 22% one-year mortality.
And you're sitting here telling me the dogma has now clashed with data, and the data will rule.
Actually, a lot of the data was there, but there was almost this scientific expedition where they wanted to prove that it causes breast cancer. And so they set out on this mission. The head investigator of that famous study that was published in 2002 had said prior in an article he wrote that we have to end the hormone replacement therapy bandwagon. And so there was this sense of women should not have access to this because of some concerns, an old paternalism that is a thread throughout medical culture. Think about the days when the medical field didn't want home pregnancy tests or home HIV tests or home COVID tests. So you saw this paternalism play out. We can't let women be exposed to this risk, even though now we know that not only were there short-term benefits with the hot flashes, night sweats, mood change, weight gain, 50-plus symptoms in the short term, but there are profound long-term effects, including living 3 to 5 years longer and feeling better and having lower risks of cognitive decline. And if you talk to doctors who have treated a lot of women with hormone replacement therapy, provided they started within 10 years of the onset of menopause, they will tell you that marriages have been saved. Women don't need an antidepressant sometimes. And ironically, a woman who comes in with menopausal symptoms has been more likely to be prescribed an antidepressant than hormone replacement therapy. So there was a lot of confusion, a lot of dogma, and a lot of groupthink in the medical field. The announcement of the original study declaring that it increases your risk of breast cancer, even though that study did not have a statistical significant difference. That thinking was, that study was announced in the media before it was published in the Journal of the American Medical Association. So it took on a life of its own. We set the record straight at the FDA when I came into office, and we announced our intent to remove the scary warnings, put all the information in the label where it belongs, and tell women the truth.
Let me ask you, Marty, about something else that people are probably seeing headlines of that might be scaring them. Measles in 20 states, outbreaks in California, Utah, South Carolina, Florida. What should people think about that? What should their level of risk, fear be? What's their advice from the FDA on that?
Well, I think it's a good reminder that kids should get the measles shot. So I think every parent should see that information.
Because most of the cases I understand at 5 to 17, kids who haven't had it as infants are developing it now.
That's right. This is not a result of anything anyone has said in the last several months or in the last year. These are kids who did not get it. We see measles outbreaks commonly in 2 communities. One is migrant children who just didn't have access to good health care. And we see it among certain religious communities that have chosen to minimize their interface with the medical community. For example, the measles death that occurred initially in Texas was in a Mennonite community. That community has not gotten vaccinated since the vaccines were first introduced to the United States in 1799 by Dr. Benjamin Waterhouse. So this is a bigger problem. It's a global problem. Many of us believe that the mistrust that expanded during the COVID pandemic from some
Has
of the
splashed over in this space.
Yeah, I think it was. I think
Harmfully,
it has caused.
possibly.
I
Your
think
advice
so.
is take the measles vaccine.
It is. And if you look at the data, by the way, the trust in the medical profession went from 71% of the public trusting us as doctors in 2019, just before COVID, down to 40% 4 years later over those 4 years of COVID. So a 31-point drop in trust in the medical profession. That's what happens when you shut down schools in the name of medicine for nearly 2 years and insist people wear cloth masks at 2 years of age for nearly 3 years. You have to be honest and show humility when the right answer is, we don't know, but we think this might help.
But if I hear you correctly, you're saying that trust decline should not alter either the data or the interpretation of that data where measles and vaccines are concerned.
That's right. And that's why we put out, as an administration, what we consider core essential vaccines. Measles is one of them. And we want people to know there is a hierarchy of vaccines. And these are the ones that we consider to be core essential. They're common to many advanced, developed European countries. It's the sort of common consensus list of core essential vaccines, and measles is one of them.
I've often told you, Marty, that you're always welcome on this program for the TV show version and for a longer conversation for the podcast and our YouTube audience. It's extensive. I know they want to hear from you, so please come back.
Will do. Thanks a lot, Major.
I appreciate it very much. Marty Makary, FDA Administrator.